138 on Super Talk 99.7 WTN. Dan Manda Show. Well, the concussion that everybody's talking about that Hillary Clinton suffered, and now, of course, she can't remember a whole lot that happened during her time as Secretary of State. I do want to bring in Dr. Chad Stevens. He is an expert on concussions from Noble Pain Management in Sports Medicine out of Dallas, Texas. And, Doctor, I appreciate you being with us. And there's a couple of different things that I wanted to talk to you about. We are now in the midst of football season, and so I know that there's been a lot of progress made in the world of concussions and how to treat concussions. But I did want to ask you about Hillary's concussion specifically. She told the FBI that because she fainted and hit her head, sustaining a concussion back in 2012, that she cannot recall some of what happened while she was Secretary of State. She started as Secretary of State in 2009, ending in 2013. So, Doctor, let me ask you a question. Based on your experience, would a concussion cause her to lose memory of some events prior to said concussion? In other words, she took a lot of this training, a lot of these things that happened that people are questioning her on, happened before the concussion from 2009 to 2012, but then she has the concussion and she can't remember the first 3 years or some of the events that happened during her first 3 years as Secretary of State. So you tell me, it sounds to me like that'd have to be a pretty darn bad concussion to actually cause somebody to lose memories.
Yes, Dan, thanks for having me on the show. And yes, I agree that it would have had to be a pretty substantial injury. I'm not aware of the extent of it, but there was some comments made about bleeding, possibly an intracranial hemorrhage. And it is possible that with a severe concussion or a brain hemorrhage, that somebody could have parts of their memory affected and they wouldn't be able to recall certain events and things prior to that injury. But I'm of the opinion that it's probable if she had that severe of an injury at that time that she would still be experiencing some of the other post-concussive sequelae that people experience, such as dizziness, memory loss, difficulty with concentration, and just depression and other things that I think she'd probably be dealing with even to this day, potentially.
Now, one of the things that you just brought up is that, the dizziness, for example. Well, we've seen a video of Hillary Clinton, and she's always, and I don't want to get too conspiratorial here, because up until, in my opinion, this weekend, there were some people who would bring up the fact that there is video of Hillary Clinton, and she's always holding on to something, and it begs the question, which is, could she be suffering still from her concussion from way back when? Because you just brought it up, which is the fact that, people who are suffering this bad of a concussion, they would suffer from dizziness. But see, to me, that brings up the whole conversation as far as should Hillary Clinton then release her medical records, which is not necessarily something I'm going to ask you about, but I think it is something that goes from a conspiratorial angle, which is what Hillary likes to say, to something that is more of a legitimate discussion. A doctor's orders at the time was that she needed to only work part-time at the State Department for a while she recovered. That was in the FBI's report that we found out about on Friday. So let me ask you this then. Could her judgment have been impaired at the time if she has a concussion so bad that she has to take time off of work and that caused her to forget a whole bunch of things? Well, then it sounds to me like the woman who was Secretary of State, her judgment was impaired at the time that she had a concussion.
Yeah, it's probable that if she was having ongoing symptoms, Dan, that her symptoms of dizziness would be aggravated by reading. As we read, our eyes go from left to right, which will aggravate a dizzy state if you have an underlying post-concussive symptomatology going on still. So that could have been why her doctor wanted her to kind of, quote, we call it brain rest, not do a lot of loud sounds, bright lights, and a lot of reading to try to rest her mind. And that may have been why they had her work at a lesser capacity or a lesser amount of hours to not put her under too much stress during that time. So whether her judgment was impaired or not, it would be difficult to say, but it would would say to me that she was having ongoing symptoms, or they wouldn't have taken her to a limited work schedule.
So she's brought up the concussion a number of different times now. So then my next question would be, we've seen videos where she does get dizzy and so forth. Would having a concussion in 2012 that disabled her in such a way, would that possibly affect her in 2017? We're not talking about an accountant here, no offense to accountants, but we're not talking about people who have menial day-to-day jobs. We are talking about President of the United States. So my question would be then, if her concussion was so incredibly bad, would this affect her in 2017 if she was able to get into the White House? If she beats Donald Trump, should we be worried that this concussion that she suffered a long time ago, could that affect her judgment as a president of the United States?
Yeah, that's a very difficult question to answer, but a good one, because there's always the debate about whether or not we should expose her medical records to the public scrutiny, or if those are our business or not. But I do think calling for a cognitive function test of some sort that would assess her ability to process information and make quick decisions and accurate decisions might be a reasonable a middle ground to consider, because that would give the public access to the confidence that she has the ability to, at least in the pass-fail format, not necessarily all the gory details about the test, because they can be kind of taxing, but it would give us a feel for if in a pass-fail sense or in an overall gestalt kind of a standpoint, it looks like she has the capacity to make decisions under fire, which is what the President of the United States has to be able to do, as you've alluded to.
Absolutely. Let's talk about concussions generally speaking now. We are in early September, so we've got high school football is underway. College football is a weekend down last weekend. The NFL is ramping up. First game is on Thursday by the teams that played in the Super Bowl last year. I know there is constant talk about concussions. We know, Doctor, that fewer kids are playing football these days because parents are worried about concussions. I guarantee you, somebody is listening, driving around at Nashville right now, and they have worries about their kids playing football because of these concussions. I've shared my experiences with my son who played football, and he suffered a concussion as well, and that was, I'll be honest with you, the end of football for him.
Yes, sir.
I know the issue has been in the limelight the last few years, although the conversation seems to have diminished somewhat. So you tell me, we are early September of 2016. Has the issue of concussions in the youth leagues with the helmets and so forth, I know that helmets are a lot better now. They're trying to make adjustments to the helmets. Has the whole problem of concussions in the youth leagues, is it getting any better?
Well, yes, I think that's definitely an issue, because there is now a class action lawsuit put forth through the Pop Warner Football League that is similar to that which the NFL Players Association has put forth. And so clearly parents of all ages are concerned, and Pop Warner signups have been down by several percent each year, the last time I checked. And so it is a problem. It's difficult because you have rules and regulations that you can make to, limit the amount of pounds a boy or girl can weigh that can carry the ball at youth sports. But there's such a dichotomy of weight and age throughout the developmental years that it can be very difficult to put two eighth-grade boys against each other and not have one outweigh the other by 100 pounds. And so it's difficult to even enact rules such as no spearing, such as the NFL has put in. And so what I have kind of come to is the best thing we can do to help the game of football is to learn how to our best of our ability, prevent concussions from occurring, or at least major head trauma from occurring. Also be able to detect when those traumas are occurring, and then how do we treat the symptoms once those have occurred? Because what's important to me is not setting a child down the status that sounds like your son did, where it was like, okay, this is just not worth it for us anymore. And so what we're doing now, Dan, is we're actually addressing concussion treatment more aggressively than we have in the past. And one way is we're using a product that inserts in the helmet to help us detect when a concussion occurs, and that is called the Head Health Network, and it's been a great addition to my varsity team's experience this year. But we are also able to treat concussions with a very simple revolutionary procedure called a SphenoCap procedure, which we do in our office. And what that is simply putting lidocaine onto a complex behind our nose called the sphenopalatine ganglion, which we've known for years is involved in the migraine symptomatology magnification. And so the thought was if we could treat people that we've treated like migraine patients to turn off of their migraine, and we could treat these post-concussion headaches, which are truly migraine headaches that are forming, and not let them get into a cycle of lifelong migraine, then we can hopefully, keep that person's life pretty normalized, going to school, going to proms,
right.
doing what normal kids do. And so that product has been revolutionary to my practice, and I think several throughout the country. And so those are kind of the things we're doing to try to prevention. We've been using inserts in the helmet that are made out of Kevlar that help reduce the impact by about 50% each time there's an impact made. And so since we can't change the rules, and since, people are always going to play aggressively and we love the game of football, the best thing we can do is try to protect the kids that are playing, detect their problems when they have them, and then treat them as immediately as we can so that they don't become lifelong problems.
One of the interesting things that I saw over the weekend, we just found out that a high school kid turned college player now, Nolan Turner, I guess he played for an entire quarter with a concussion last year because nobody knew that he had one. So how is that possible that this kid, either he didn't tell anybody or he didn't realize that he had a concussion? Is that possible for somebody not to know they had a concussion? And very briefly, sir, what should parents and coaches look out for when their kids are out on the football field? In 30 seconds or less, tell me what are some of those symptoms that we should look out for as players are on the field?
Well, those are very difficult things to see, but most parents are watching their own child more than they're watching the game. And so if they see their son or daughter coming out of a huddle and looking like they're going the wrong direction or having to be directed by the quarterback or the coaches, that's one indicator. If the quarterback runs the wrong play or he appears to get up slowly from a hit, that's another one. There are certain hits that are very clear impact that make both parties look as though they are stunned, and those people need to be brought out and evaluated. And that's what I was saying. This young man, if he had an insert in his helmet that showed his impact was significant enough, he would have been pulled from the game and evaluated by a trainer prior to return to play. And so I think that might have helped in that situation, but it's oftentimes the athlete themselves who are afraid to tell the coach or the trainer that they have an injury because they don't want to be pulled from the game. But it's establishing rapport with your child that if you have a problem, it's okay to go to the coach or trainer. You'll actually get back in faster if you're honest with them and yourself, and it will decrease your long-term problems if you do that.
Dr. Chad Stevens, expert on concussions from Noble Pain Management and Sports Medicine in Dallas, Texas, and again, known around the country as an expert in concussions. Doctor, appreciate you being with us. It is 1:52 on Super Talk 99.7 WT.